and works clinically. We are recording. um, in the emergency department of Holy Cross Hospital in Fort Lauderdale, affiliated with the University of Miami. Dr. Jackson worked as a senior doctor aboard numerous cruise ships to lead medical operations and emergency drills. And she has also presented and published in numerous cruise medicine research projects. So Dr. Jackson, I will stop sharing if you would like to begin, and thank you for coming and giving us your time.
Thank you, Owen. That was excellent. And welcome everybody. As you can see, I'm here in the Port of Miami, and I see that some of you are all over the country today and are maybe in a snow-filled city. We're actually having an overcast day here in Miami, but it was sunny yesterday. It did look like this yesterday. Just give me a second here and I'll share my screen. I just wanted to thank Shilpi and the board of the Wilderness Medicine group to put on this speaker series. I've hopped on a few over the past semester, and I think the topics are very high yield and very interesting. And I love that this is going national and international to expose our students on the future career options for emergency medicine and all of the really unique things that are non-traditional in ways you can use your medical degree and impact patient care in some of the most remote parts of the world. So I'm going to tell you a little bit about cruise ship medicine, which is a passion of mine. And for those of you that don't know me, I grew up in South Florida, and I've been going on cruise ships as family vacations since I was probably like 5 years old. And this is how our family vacation. We would just hop in the car and drive to the Port of Miami or Port Everglades and hop on a cruise ship. And that was our family vacation for spring break, summer vacation, Christmas vacation. So I've been on a lot of cruises, and as my medical training evolved, I became a lot more interested in the operations, the medical care at sea, and I was fortunate enough to be able to deliver care on the ship and have done some cruise medicine research. And like Owen said, I'm also involved nationally in the cruise medicine section of ACEP. So I'm going to go ahead and get started here. Hopefully y'all can see my screen. This is my disclaimer that this is an educational presentation tailored toward a student audience, and is focused primarily from that perspective to give you a delve into cruise ship medicine as a specialty and what it all entails, and how that may be a future career option for those of you on this talk. And it's not meant to represent any opinions, views, inside information on any of the corporate commercial cruise lines. So just to give you an overview here on and some of this, like I said, is going to be pre-COVID. Obviously, the cruise industry is in a different state right now currently because of COVID. So this data is obviously pre-COVID. The cruise industry is really expanding. The average length of cruises across the world is 7 days. So people are spending quite a bit of time on board ships. Both obviously as passengers, and these voyages are long and can go all over the world. And some, I'm sure as you've seen, itineraries can be up to 6 months long and be around the world cruises. Just to give you a perspective, a snapshot of the number of guests that travel across one of the largest brands in the cruise industry, Royal Caribbean. They've seen an explosion of guests as their fleet has expanded, and in 5 years have increased the number of guests by 1 million in a year, from 5.1 million to up to 6.5 million guests a year. The fleet has also increased, as I'm sure you've seen. The ships have gotten bigger and bigger, and every year they're introducing more and more into the fleet. Pre-COVID, now obviously this has changed because there's been some fluctuations in the fleet, and they sold off some of the older ships, etc. But pre-COVID, there were 61 ships in Royal Caribbean's fleet, and it covered multiple brands under the umbrella that include Royal Caribbean Celebrity, Azamara, TUI, and Sky Sea. And so the medical team at the corporate office, whether it's Royal Caribbean or Carnival or whatnot, deliver care and oversee the operations of all the ships in the fleet across the different brands. And these ships can be quite big. They can be tiny ships, and they vary in size. So they can be tiny ships that are with a capacity of around 700 passengers, and they can be really large mega ships that can be about 6,000 passengers on board. And at any one moment in time, again, this is pre-COVID, but at any one moment in time, there would be about 140, 150,000 guests at sea across the ships, with 43 to 45,000 crew members at sea. So this is quite an operation of people that are either in port or at sea and on board one of the ships. And obviously injuries happen, medical emergencies happen, and care needs to be provided to these people. The medical team is comprised of 70 physicians, 32 chief nurses, and 76 nurses that support the delivery of care to the guests and the crew. The cruise medicine section of ACEP is a very robust section of the American College of Emergency Physicians and comprises of the chief medical officers of the major cruise lines, some very experienced doctors that spend annual contracts at sea, along with key players and stakeholders in the delivery of care at sea. And every year they meet at the annual meeting and discuss a variety of different things related to patient cases, policy related to cruise medicine, and there is a set of guidelines entitled the Healthcare Guidelines for Cruise Ship Facilities. It was first developed in 2013 and was last updated in 2020. And this is the industry standard on what the minimum requirements are, or suggested minimum requirements are, for the medical facilities and the medical centers, staffing, credentialing, medications, and the abilities in the healthcare facilities on the ships. So the healthcare guidelines from ACEP, like I said, they set up the medical facility, how many exam rooms, the ICU capabilities, staffing credentials related to emergency medicine, internal medicine, or family medicine training, what the communication and clinical practices and how that relates with shoreside services and shoreside backup, and then what the audits and QA of the delivery of medicine at sea looks like. Documentation expectations regarding patients, that has transitioned, especially in the major cruise brands, into an online electronic EMR in the last 3 to 5 years. Equipment expectations, both for true emergencies, but also for accidents and minor emergencies, what the lab and pharmacy capabilities are, and basics related to infection control and how that intersects with international and national expectations and regulations. There's also imaging that can be performed at sea. Most ships, especially the large ones on the main corporate brands, have portable X-ray capabilities to do basic X-ray. And there are some ships that are expanding bedside ultrasound, though that's not an industry standard at this time, but there are some ships that have included portable point-of-care ultrasound. There are some aspects related to medical legal practice, and particularly as that pertains to sexual assaults that occur on board, and the gathering of forensic evidence and how that gets transmitted and passed on to legal and authorities in whatever the port country is. And then, you know, the cruise industry is obviously not a healthcare system. It's a travel industry. It's part of the hospitality industry and is focused certainly on travel experience and customer service. And so there are patient feedback surveys and happiness of guests and making sure that we're meeting their needs. And some of that may happen before a voyage. If someone has a serious chronic medical condition that would require accommodations while on the voyage, certainly that will get conveyed to the medical team before the day of embarkation. And then there are always medical drills that occur related to fire, related to man overboard procedures, medical emergency drills. There's a whole variety of safety drills that happen on a weekly basis on board the ship. And the role of the medical team and the doctor varies depending on the drill, but there's very routine, regular training for a variety of different scenarios that may happen at sea. I have some pictures here. Obviously, as Owen said, I've been fortunate not only to be involved in experiences on the shore side and the medical operations team in Miami, but I've also had opportunities to go on board as the doctor and senior doctor on some of the voyages over the years. So this is what a standard kind of formulary pharmacy looks like. So they do have a fair amount of medications on board in a variety of different classes. Interestingly enough, because these are international companies, the formulary is a hybrid of drugs from America, United States drugs, also Canadian drugs, and European drugs. So there are some drugs that we don't use in the United States that you may find on board that are used in other places of the world, but have pretty strong evidence. So it's just kind of an interesting nuance, is that everything you might find in America, you're not necessarily going to find on board of a cruise ship. But there are a variety of medications, both from medications for antibiotics, medications for blood pressure, thyroid, GI medications, cardiac medications, medications that are required for urgent situations, but also remember that the medical team provides care to the crew. And so the crew may be asthmatic or diabetic or hypertensive and need to have those chronic medications filled and provided to them on a regular basis. And certainly that is one of the elements that the medical team provides. Okay, so this is a nice segue. So the medical team on board cares for not only the guests, but also the crew. And the crew can require primary care. They can require emergencies and injuries. And encompasses a whole variety of different presentations. So certainly medical emergencies and critical care are of high priority of the medical team, and it's an all hands on deck approach for that. But the daily clinic operations, a lot of it is primary care, dental care, orthopedic care, and even psychiatric care. I mean, some of these crew members are on very long contracts. They're very far from their family. There may be a stress going on in their family, in their home country, or I've even had crew members that have been stressed out by geopolitical war or economic issues. And it's hard sometimes to communicate with their family, and that silence is, it can be very upsetting, especially when they're isolated at sea. So it's a whole variety of complaints that come in and different types of patient presentations that come in that makes it a little bit different from a standard emergency department. So just as I had mentioned, the crew medical part of things is primarily a lot of primary care related to blood pressure, diabetes, nutrition, exercise, smoking cessation. Most of you probably recognize that it's a very diverse and international crew that staffs the majority of the large corporate cruise brands. And some of them have very specific cultural dietary habits or social habits that impact their health. And so it behooves the medical team to do primary care and health counseling related to smoking cessation, exercise, nutrition, eating habits, etc. And the crew does get injured, particularly in the some of the manual labor jobs on board in the engine room in the Marines. There can be chemical burns, there can be traumatic injuries, lacerations, falls, etc. And then some of the repetitive jobs on board, so like the housekeeping team, the waiters, because they're doing repetitive movements so much and so often, they sometimes can have some degenerative changes that require physical therapy to enhance their overall abilities. So there are injuries on board that do happen. Like I had mentioned, about 14% of them in the crew occur in the marine sectors. So these are people that are in the engine rooms that are doing the inner workings of the ship primarily. But some entertainment crew members may get hurt. The dancers obviously can sprain their ankles and fall. And there can be upper body injuries, back pain, back injuries, etc. Certainly open wounds can happen. In the galley, in the kitchen, there's steam burns that can happen. People drop things, the glasses, the trays drop, and there may be a glass laceration, etc. And obviously, in a closed system at sea, the workforce on board is important, and you want to have a healthy workforce to be able to maintain operations. So minimizing time off and expediting healing so that the crew can get back to maximum productivity is an important thing to focus on, so that it minimizes lost time. On the guest side of things, you know, most of the guests are not used to the sea waves, and particularly when combined with alcohol and elderly age and other medical problems, there may be trips and falls that happen. And so there's a lot of falls on board cruise ships in the guest sector. They fall downstairs, they fall in the hallway, they you know, slip and fall on the tile with fancy shoes, etc. So the primary location for these injuries is more lower extremity, fracture, dislocation, etc. And there can be a fair amount of injuries in the cabin. Most of the cabins in the guest sector are pretty small, so it's very easy to hit your head or, you know, to kind of run into something, etc., that may result in an injury. Medical disembarkations, certainly the medical team and the doctor and senior doctor will be responsible for the orchestration, approval, and successful medical disembarkation of anyone who's not fit to travel at sea. And there are a variety of different ways you can medically disembark a guest or crew. You can do it by helicopter, where a helicopter comes and either lands on the ship and helipad or hovers over the ship and does a basket transfer. You can do a sea tandem transfer, where the side of the boat opens up and another rescue vessel from the Coast Guard will tandem right up, and there'll be a transfer directly across the open water. You can disembark in port and either do a speed up or a port diversion. And obviously these last two can be quite expensive in cost, and can be huge decisions and multi-million-dollar decisions when all things are said and done. So certainly speeding up the ship and expending more fuel or going into a port unexpectedly has a financial cost and expense related to it. Or diverting a ship to a different port will change the itinerary, can change the entire length of the trip, especially if they have to go backwards instead of forwards. And certainly there are a lot of financial impacts related to that when spread across the entire voyage. And like I said, those financial impacts can easily go into the $1 to $2 million range per disembarkation. This is an example of Carnival's Fleet Operations Center. So the Fleet Operations Center does everything related to every ship at sea, but is critical when you're disembarking a patient at sea. So you can see it's an entire floor of one of their corporate offices in Doral, and you can see that they have every ship listed here. It gives data related to engine and gas, so that's what some of the green and the red and the yellow is. It's plotted across the world, so you can see exactly where they are in relationship to the different countries. There's overviews here on the far side with the weather, so you can see what the ocean currents are, where the storms are, etc. And this whole center has a variety of different people who have different roles, and they can tell you how quickly a ship can speed up and what that would look like, so you can get time estimates. You can get information related to fuel, how much fuel they have, and whether that's something that is doable for a disembarkation. And they have a support that is with the different ports all across the world and the port authorities. So this is staffed 24 hours a day, 7 days a week. There's always someone on call, and they can respond to a variety of emergencies, which include medical emergencies. And they can get different information related to different events that are happening on the ship that may impact a successful voyage. And so, like I said, this is monitored 24 hours a day, all the time, and it's a huge footprint. And there's a lot of different people that can support the operations of the fleet. So most of the cruise ships have something like this, a command center, And so this is just a snapshot of what the one at Carnival looks like. There are additional tasks for the medical doctors at sea, and there's some administrative and operations that are one of the responsibilities in addition to the medical care. So they are involved in the executive committee and involved in budget and revenue, again, from within the lens of the medical center, but that is an important part of the overall ship's voyage and the overall productivity of the cruise. They are involved in inventory, so looking at supplies, looking at expiration, when things need to be ordered, pharmacy formularies, and renewing crew prescriptions. Sometimes people need to be disembarked in the next port to have a subspecialty referral, and so shoreside referrals is something that's coordinated. So for instance, perhaps there is a crew member that has a dental carie and needs to see a dentist. So they may arrange for the next port in Grand Cayman for the crew member to be disembarked in Grand Cayman and go see a dentist to sort out the dental carie in the cavity, maybe get it filled, whatever. And there's a whole process with shoreside referrals, both from transmitting the medical information, but coordinating transportation so that this can successfully happen in the few hours that the ship is in port. There are logs on board that get audited and have to be reported to different governmental organizations, so related to injury. And then there's also GI and respiratory logs to do infectious disease surveillance. And most countries have medical clearance forms that have to be filled out. The physician has to fill out before the ship can dock into the port. And this happens on a daily basis. So when I was in that role, they would come to me the night before and say, here's the medical form for instance, for the Bahamas. So there's a medical attestation. You have to put a whole bunch of information related to the state of all of the passengers and crew on board, all the people on the ship, and sign off on it. And then that gets submitted to the port authorities as part of the clearance of the ship as it arrives in port. And this is done, like I said, on a regular basis. And then, like I mentioned before, depending on the different safety and training drills that the team participates in, there's different expectations and roles related to that, both as a participant, but also sometimes as a leader. So these are some of the safety drills, the medical code. So certainly if there's an emergency on the ship or code on the ship, there's a full alert that goes out and the entire medical team responds, just like calling 911. Man overboard, fire, lifeboat drills. These are some example of safety drills that occur. In the United States, the CDC, Center for Disease Control, has a vessel sanitation program, and these are the health regulations that the cruise companies that port in the United States have to abide by, in addition to US Coast Guard health regulations as well. But the CDC vessel sanitation program is the big one that focuses on water safety, related to metals in the water, because again, most of the cruise ships use their own water supply through desalination process, and also use water in the swimming pool. So making sure that that's safe water, that the metals in the water are not going to affect those that are using it and drinking it. And so that's monitored. Food safety, environmental safety, infection control and GI illnesses, respiratory illnesses, and there are routine public health inspections that are unannounced and happen on a biannual basis by the CDC. Most of the other countries in the world, especially in Europe, in Brazil, in Canada, and in parts of Asia, in Australia, have a similar entity, governmental entity, and most of the regulations are pretty much the same to help standardize things. There are some nuances across the world that have to be maintained and be in compliance with. So you can go on the CDC's website, and this is a snapshot. Every ship that's docked in the United States is examined and undergoes a health inspection that looks at all of these things, and they'll literally walk around the ship and test the water and test the temperature of the dishwasher and look at the log books and the GI illnesses and what was done. And they'll do a variety of safety checks in the different domains across the ship unannounced. So they just show up at the port and say, hey, we're here from the CDC and we're going to do an inspection. And so that report gets a score, and you can go on and see the latest score for any ship and what the report and corrective actions are. And there's some more details here. So for instance, you can see that there was someone in the kitchen on this ship that had 4 episodes of diarrhea and then waited several days before they reported it. So there was some disciplinary action that happened, etc. There was some food that was left at the omelet station. All of these types of things get documented by the CDC during the inspection, which can take about 4 to 6, maybe even 8 hours, depending on the number of violations and how big the ship is. So I'm going to briefly talk about norovirus. I'm not going to go into COVID very much because that's still an ongoing thing. I can certainly answer some questions, but I'll talk briefly about norovirus, which really was the epidemic that affects cruise lines the most before COVID. And then we'll have some time at the end for questions. So certainly norovirus is a seasonal infectious disease outbreak, and it seems to be tagged to cruise lines and kind of gives cruise lines a bad reputation. And it's not unique to cruise ships. There's nothing special about norovirus that it goes on to cruise ships or lives on cruise ships, anything like that. The thing is that obviously the cruise ships are a confined space, and the other most important thing is that it gets reported. So once you reach a critical mass of sick people on a ship, it has to be reported to the CDC, which then is what makes it into the press. So that's why you hear it more than if there was a norovirus outbreak at a nursing home in your local town or at the hotel in your local town. That stuff definitely happens. It's just not mandatory reporting, so it doesn't make the press, it doesn't make the news, etc. It has a short incubation period. So what happens is they've done really good epidemiology and have shown that most of the norovirus outbreaks are because sick people or asymptomatic people bring it on board the ship and then spread it in the common spaces to crew members and guests. And because it has a short incubation period, particularly when your voyage is 7 days or even longer, it's very easy to have an outbreak on a ship. And children can shed the virus longer in the stool, and obviously this can be a little bit more difficult to manage because of the hygiene of children and the playgrounds and the ball pits and all of those types of things. Most of the people on land, only 10% of the time seek medical attention, and so that's kind of similar numbers on the cruise ship. And about 50% will report on board because, you know, they want to try and continue their voyage, and, you know, they don't want their vacation interrupted, etc. And up to 30% can be asymptomatic. This is just some fun facts about how there's 1 billion viral particles in your stool of norovirus, so it's a very easy to spread. And it can be spread and transmitted through public vomiting and aerosolization, from fecal oral surface transmission, and from water, food, and ice contamination. So they've actually looked and seen that there have been outbreaks that they've been able to pinpoint to very specific ice machines on board, or very specific tongs at the buffet, you know, very specific contamination of maybe the handrails down a cabin corridor from sick passengers, etc. And the ship, the medical team and the public health epidemiologists that work for cruise companies are pretty good about being able to track these epidemics early to try and mitigate any large outbreaks and minimize the need to report it, you know, as much as they can to kind of control it on board before it gets to a reportable level. Norovirus has a season. It's very well reported that most of it happens sometime between the fall, usually October to March, April time. So like Halloween to spring break is norovirus season. And that is when these outbreaks pretty universally happen. You can check and see online how many outbreaks the ships have had, the different brands have had, and it gets very granular when it gets reported to the CDC. Stool samples get sent to the CDC, so that's where the causative agent comes in. Very rarely is it anything other than norovirus, and you can see the dates here are pretty much more or less Labor Day to spring break. So that's norovirus season. The challenges are public health mitigation strategies on board. So, these things get spread when a waiter puts a contaminated hand into the ice or the ice scoop to fill up your drink. If they fail to report, if guests lie on the pre-health questionnaire and actually bring it on board because they want to have their vacation, they don't want to lose their money, maybe they flew in from out of town. There's issues with cleaning and sanitation and how whether that's adequate or inadequate, cross-contamination. So maybe you're at the dining room and the people that were at that same table in the main, there's different times of serving. So maybe the people that were at the table right before you at dinner, maybe someone was sick there and they put their hands on the side of the rail of the chair, and then you put your hands on the rail of the chair, or in the lounge watching the show, all those types of things, you can get contamination. And then they've done studies that have shown that the airports, so Fort Lauderdale Airport is a huge cross-contamination. The different ports, so when there's 6 and 7 ships in St. Thomas, those jewelry stores are good sources of contamination. The different souvenir shops in those ports can have cross-contamination. And it's not just at the same time. They've shown that, if you're in port in St. Thomas or St. Martin one day, and then another ship comes in the next day, some of those stores can be sources of contamination. And then all of the transportation and buses for tours, transfers to airport, etc. And obviously this is compounded because the crew is international. Some of the countries that they're from have different levels of sanitation to begin with, and hand hygiene may not be something they've ever learned in their life. They may not have running water or proper plumbing, and these types of things just don't exist in some of the countries where the crew is from. And certainly as the voyages go around the world and enter in different ports and that have different levels of public health and infrastructure, it can obviously affect the disease transmission. So this is the questionnaire that if you get sick on board that the CDC provides. It's a screenshot. So they want to know very specific things like what airplane you were on, what hotel you sat at, what dining room table you're in, what cabin you're at, what you ate, where you ate at, if you ate at the Windjammer, if you ate at the pool, if you ate in the dining room, whatever, and what shore excursions you've gone on. And then they've been able to put these into databases and track and see and be able to pinpoint different locales on the ship. This is the back side of it. So this is all the meals. So breakfast, lunch, dinner, snacks, what you had, where you had it, etc. And so this is an example of screenshot of one of the decks on the cruise ship and a norovirus outbreak. And so you're able to, all of these horizontal lines are cabins with affected passengers with norovirus. And so you're able to identify clusters and enhance sanitation in the cabin by the housekeeping team, and then also to try and alert the housekeeping team so that your cabin attendant remains healthy. I'm going to quickly talk about my research related to cardiac arrests, and then we'll pretty much be done here. One of the things that I was most interested in is the delivery of advanced cardiac life support in cardiac arrest situations on board cruise ships. And so I did a 5-year study in conjunction with Royal Caribbean looking at that endpoint. It's retrospective. And we looked at the final destination of the patient, whether they were medically disembarked and off the ship with return of spontaneous circulation, or whether they died on board. And these are just some of the inclusions. Basically, if you were dead on arrival and no medical care was delivered, you were excluded. And if resuscitation was attempted by the medical team, we included them in the analysis. There were actually 168 cardiac arrests. As the fleet has grown, these numbers have increased. And at a major corporate cruise company, there's roughly a cardiac arrest a week that occurs across the fleet. Most of the cruise lines have a person who's dedicated specifically to deaths on board and, dealing with those families and body repatriation and all the authorities that get involved in these types of situations and getting people to where they need to go, where their home is, and where families want to be buried. Most of the people that are involved in cardiac arrest are male as opposed to female. And the average age is similar to what we would see in the United States. 67 is the average age, slightly younger for females, 65. But as you can see, the range is huge. So 26-year-old male had a cardiac arrest, up to 93, and 41 to 85 for women. So it's a big age range. And these are just some pictures showing the age distribution by male to female. There are crew that have cardiac arrest, even though they go through an extensive medical screening in order to be deemed fit to go to sea. There are some crew that have cardiac arrest on board, and they're at a much younger age just because the population of the crew is younger, and they're more active and such. So the cohort is a little bit younger, and probably because of that, there's some successful outcomes. So there were 5 crew cardiac arrests, and 4 of the 5 had return of spontaneous circulation. And the cardiac arrest can be really from anything on board, anything from acute heart attack, an MI, CHF, pulmonary edema, pulmonary embolism. And then you can have all kinds of things like sedative hypnotic overdoses and sedation. People take their medications and then they have co-ingestions with alcohol, et cetera, that maybe, on top of that, they have sleep apnea, and the next thing you know, they're in a respiratory and a cardiac arrest. There have been arrests related to anaphylactic shock, septic shock, diabetes, all kinds of arrhythmia, different arrhythmias, et cetera. So it's really the full gamut that can cause these arrests at sea. Most of the arrests occur in the cabin. 57% of cardiac arrests occur in the cabin. And I think why that happens is because passengers or crew don't feel well. And so they say, oh, I don't feel well, I'm going to go back to my cabin. And then someone else in the cabin continues on whatever they're doing, either vacationing at the pool or working in the job. And then they come back and find the roommate or their cabin, whoever they're living with in the cabin is in distress. The other variant is obviously like the middle of the night cardiac arrest, where someone gets up and they go to the bathroom, they feel a little short of breath, they don't feel well, so they get up and go to the bathroom or have water, and then boom, they have a cardiac arrest. But there are some public arrests that occur in the spa, in the gym, in the restaurant, in common areas, in the theater, et cetera. And then of course the ones that feel sick and get to the medical facility and then arrest down in the medical facility. So we looked at all of the times and the outcomes. The response time is very quick, which I think attributes to the successful delivery of ACLS on board. The medical team is easy to immediately be dispatched once it's alerted, and has about a 2-minute response time, which is obviously drastically different than if you had a cardiac arrest right now and called your local 911. The response time for EMS locally can be 8 minutes, 10 minutes, even more, depending on what city you're in. Bystander CPR does happen, and happened in a number of our patients in the cohort that we noticed, and about 38% of patients that had a return of pulse had bystander CPR initiated, either by guests, other crew members, or family members. AEDs are on board most major corporate cruise lines and as part of the ACEP recommendations for equipment. And so certainly the initial rhythm is associated with outcomes. And so 41% had a shockable rhythm, 58% had a non-shockable rhythm. And as you can see, if you have a shockable rhythm, there's a higher percentage of your survival with return of spontaneous circulation on board. The location of the AEDs are strategically evaluated. Most of the ships have 5 public AEDs near the spa, near the theater, near the dining room, etc. The large mega ships like Oasis and Allure have 10, and these are kind of the locations: the gym / spa, the pool, the restaurant, the central guest relations, and the engine room. And when the crew gets, or when the medical team gets dispatched, they respond with an emergency responders bag that also has AED, has ACLS meds, similar to what a paramedic would respond with. So this is just a snapshot of where on a large cruise ship the AEDs would be located. And as you can see, when most of the cardiac arrests happen in the cabins, that's not where the AEDs are. So being strategic and the placement of the AEDs is something that might be looked at in the future. So we looked at and found that 57 patients had return of spontaneous circulation, which was a 34% rate. And how does that compare with if you have one in your home right now with EMS? So out of hospital cardiac arrest in the United States, the rate is somewhere between 3 and 16%. So obviously this is important to know and is of higher much better outcomes than pre-hospital cardiac arrest research and land-based United States. We compared it to the casino data. So there was a trial or a study where they looked at the casinos and when when visitors in the casino had cardiac arrest and when they were able to defibrillate them and respond. And all of this was done through video surveillance and video analysis. They were able to pinpoint times, et cetera. And so the casinos had if you had a VFib arrest, you had a 59% survival to discharge. When we looked at the cruise ship, if you had a public shockable arrest, so something similar, right? So if you arrested on board in the casino on the cruise ship and had a shockable arrest, presumably VFib, VTAC, your chance of ROSC to medical disembarkation was 75%, so slightly higher than the casino data. And then all comers, so shockable and non-shockable public arrest was 52%. So it just goes to show that the cardiac arrest, resuscitation, and all of the training that the medical team gets on board and all of the capabilities, the critical care capabilities, is pretty robust on the ship. These are just some age demographics that are pretty consistent. 27 passengers had rearrest events. So they arrested, they got pulses back, they were able to be stabilized for a temporary period of time, and then they rearrest. And most of those ended up in death. 5 did continue to survive. So second cardiac arrests are usually pretty fatal on board. And then, like I had mentioned earlier, sometimes disembarkation can be a really long time. You might be in the middle of the ocean somewhere. You might be in a situation where the government won't let you port. You might not be able to, the weather may not be ideal. And so the critical care on board can be anywhere from 30 minutes to 50 hours. So making sure that the medical team, the doctors and nurses are able to provide robust, advanced post-cardiac arrest care to improve neurologic outcomes and improve survival and overall minimize overall long-term morbidity is really important. We did look at the average disembarkation time, and it was about 10 hours. So it takes about 10 hours to get these people off the ship. And either that's like speeding up or turning around, et cetera, but it can be up to 50 hours. So you may have these patients for several days and they're quite sick with limited resources and medications. The downtime, so cardiac arrest to ROSC, the downtime's average was 19 minutes. So these people aren't, the ischemic time, 19 minutes is the average. Some you get back quicker, some may have a little bit longer. All right, so that's a little bit more on the downtime and the length of disembarkation. And they can be disembarked all over the world. So this is where, at least in the 5 years, they were disembarked. Most of them are in the Caribbean and in the Eastern Seaboard. And so obviously at we get these in Miami, Fort Lauderdale, on the receiving end, but they can be anywhere. They can be anywhere in the world, in any country. And so obviously there's some places in Europe and Asia that receive these as well. So, moving forward, when you're looking at these types of things, you have to be strategic on the delivery of the medical operations and training and expanding first responder, making sure that some of the crew might get trained in compression-only CPR, looking at the location of the AEDs on board, length of resuscitation, resources utilization during the resuscitation, and then some additional higher level adjuncts that currently aren't used, including hypothermia, end-tidal capnography, and even bedside ultrasound. So I think that's it for my presentation. I didn't include COVID in this because it's such a hot topic and is a moving target. I'll say about COVID is there was a lot to be learned. I think at least in the United States, we saw that the intersection of the cruise ships and the ports in the United States is really important. And especially in South Florida, we saw that where the ports didn't allow the cruise ships to dock for several days with sick passengers. And so that's something that is going to need to be addressed. Obviously, the role of the COVID vaccine and getting both the crew and the passengers vaccinated and what that looks like across the entire world is important. And then they're having all of these trial voyages where they're going to try their different health policies and sanitation programs and mitigation strategies and see if that's something that's able to contain COVID. They need to obviously have testing on board and mechanisms to support the detection of COVID and isolation of these passengers in addition to the PPE. And so there's a lot of issues. And even in some of the trial ships that have done these trials, they've still had outbreaks. And obviously this varies across the world because there's different health organizations and regulatory bodies and port authorities that have different opinions and perspectives and way of sorting this out. So I appreciate your time, and I hope you learned a little bit about medicine at sea, at least from on cruise ships. And I'll be happy to answer any questions.
Thank you, Dr. Jackson. Thank you for your time. Amazing presentation. I'm going to hand it over to Claire to go through the Q&A.
Yes, thank you, Dr. Jackson. We've got quite a few questions, so we'll see what we can get through now. And
Okay.
then maybe we could email you the rest if you get a chance to respond to them.
Okay.
So one of our questions that we got a lot was, how often are medical disembarkments required? And is there any specific medical incident that's protocol to disembark?
They do happen quite frequently. I can tell you that almost every voyage I was on, we had to disembark someone. So I've definitely had Coast Guard disembarkations, some that have even made the national news. I was involved in one in the Chesapeake Bay that made the national news. And we've had, you know, I would say almost every voyage I've been on, I've had to disembark guests or crew. They happen very frequently. And there's a low threshold to, if someone's sick, the last place you want them to be is on the cruise ship. They need to be in a hospital, being evaluated, being stabilized. And so as upsetting as that may be, particularly to the passengers, this might be a vacation of a special significance, an anniversary, a birthday, whatever, that they've saved, you know, 2 or 3 years worth of money and flown across the country to do. You know, it's important that you remember that their health is number one, and you don't want to be in the middle of the ocean, you know, resuscitating somebody if you're able to prevent that on the front end.
Yeah, of course. Do cruise ships have any surgical capabilities on board?
Not usually. It's very limited, those types of procedurals. I mean, you can do like basic procedures, but not, you know, like an appendectomy or anything. And the skill set of the doctors, remember the credentialing, the skill set of the doctors are primarily medicine, internal medicine, family medicine, and emergency medicine. So they don't even have that skill set to perform surgical procedures. I mean, it would really be within the context of a temporizing emergency.
And then somewhat similarly to the emergency, have you ever faced anything challenging where there was not as much equipment on board that you would have liked?
Me personally, no. Most of the ones I've been pretty quick at, you know, we're going to disembark you. I'm worried about you. I'm worried about, you know, there's lab capabilities. So a lot of the times you can back up the decision or your rationale with labs, and there's x-rays as well. So I personally haven't had that, but I'm sure that the people that stay on very long durations contracts have been in those types of situations. So yeah.
Do you think there should be greater requirements for medical screenings for cruise ship passengers?
Obviously there are variances of that around the world. United States has certain standards, but again, Canada has different standards. South American countries like Brazil and Asian countries have very different standards. I think a lot of that's going to change post-COVID as far as medical clearance and screening and what's required. The crew is there's a whole medical screening in order to be deemed fit for sea for the crew that they have to go through with a physical exam, a whole battery of labs. There's a bunch of vaccinations that are required in order for them to be on board. And I would expect that some of those types of requirements will ultimately be expanded to the guests in order to maintain cruise operations safely, successfully, and healthy. But what that looks like, I think, is still being discussed, and how that gets relayed. You have to remember there's been, if you look in the literature, there's been other infectious disease outbreaks on cruise ships. It's not just norovirus and COVID. They've had, Ebola. When Ebola was going on, that was a big problem. They had Zika outbreaks and Zika affected patients. They've had chickenpox outbreaks where someone has chickenpox on board and has affected many people. So these types of infectious diseases pop up all the time on cruise ships, and then just mitigating it and modifying the public health strategies and the operations and the contamination is important.
Maybe we'll make this the last question because we're reaching 6 o'clock, but you mentioned that you had medications available that were not available in the US. How does that work when you're docked at a US port?
It doesn't matter. They're still on board. It doesn't matter. So it has nothing to do, because the cruise ships, remember, aren't officially registered. Their flag state is not the United States. So what they can and can't do on board is a little bit gray because of that. There's a lot of rules and regulations, and even in the United States has a whole variety of maritime laws affecting not only cruise ships, but all the cargo ships and vessels that are in and out of the ports. So it doesn't change just because you're on an American itinerary.
Well, thank you so much for your time. We don't want to keep you late or anything, and it was just very insightful and very enjoyable talk.
Yeah, hopefully everybody learned something, and certainly if you have any more questions, feel free to email me. I appreciate this opportunity, and I'm so happy for the success of this group, and I think it's a great venue for students to learn and for different physicians to showcase ways you can be innovative in your career outside of the standard hospital or private practice. All right, take care, everybody. Stay safe.
Bye. Thank you, everybody, for coming this week, and hopefully we'll see you guys next week. And enjoy the rest of your day, evening, afternoon, wherever you're at, and see you guys later. Bye.
Bye, everybody.